Assalamu alaikum guys, welcome back to my YouTube channel. So today we are going to discuss about the direct and indirect light reflex pathway, and it is a very easy topic, and you guys can get it in first go. You just need to stay focused, and we are going to discuss in detail the pathways for both of them, and where if any lesion can occur, then what will happen. And there's another thing in this topic, that is relative afferent pupillary defect. We are going to discuss that also, so which there's a defect in the afferent pathway in that case. So first let's discuss the direct light reflex, and then we'll come to the indirect and so on. Okay, so we have drawn the basic diagram of the eye, the right eye, the left eye. From there the optic nerve comes, and then the optic chiasm, and then the optic tracts. So let's say light is shown into the right eye first. Okay, from there it will travel through the afferent nerves pathway, and this crossing over to the other side. Don't confuse yourself, I've just drawn the visual pathway. Actually, I'm just demonstrating the visual pathway here, that the visual pathway also crosses over to the other side as well as stays on the same side. So from there it will go on the same side through the optic tract. It will enter the optic tract, then it will go to the midbrain. In the midbrain there are pretectal nucleus and the Edinger-Westphal nucleus. Now after innervating the pretectal nucleus, this will innervate both the Edinger-Westphal nucleus, and this is the reason for the indirect light reflex, because since the other nucleus is innervated as well. So let's discuss this in the indirect pathway. Let's stay on the direct light reflex till now. From the Edinger-Westphal nucleus, it will go to the third nerve, third oculomotor nerve, the parasympathetic fibers, to the ciliary ganglion. Now this is situated near the eyeball, the ciliary ganglion, and from there it will go through the short ciliary nerve and innervate the constrictor pupillae muscle. This constrictor pupillae muscle causes the constriction of the pupil. So just remember, in the midbrain, the innervation of the two Edinger-Westphal nucleus is responsible for the indirect pathway, and the direct light reflex is just the afferent and the efferent nerve on the same side. And so if there's a lesion in any of this pathway, this can result in any anomaly, or there should be no constriction then. Now let's come to the indirect light reflex. So everything is the same. We're going to discuss make the pathway again to make it easier for you. And the main differentiating feature is that the Edinger-Westphal nucleus of both sides, just we discussed earlier, that's the basic difference from the direct light reflex. So in this one, the direct as well as, and so in usual, if you shine light into one eye, obviously both pupils constrict, right? But if there's any anomaly, let's say in the midbrain, or the Edinger-Westphal nucleus of the other side is has some lesion in it, then obviously it won't work. There should be no constriction then. So this is the basic concept of these two light reflex pathways, and there's no detail other than this. This is the main thing that will come in exams, and this is what people or students, med students, confuse. But this is if you look at the diagram, if you remember the diagram, then there is no need to be confused. Now let's come to the relative afferent pupillary defect. So let's discuss relative afferent pupillary defect. Now if you look at this term, that means the afferent fibers of the pupillary, this light reflex that we are talking about, that has a defect in it. And it is relative to the other eye. See, we are talking about the two eyes, so it is relative to the other eye. The relative and afferent, the afferent fibers are defective of the pupil light, the light reflex, which results in the constriction of the pupil. So this is this is what it means, and this in short we say RAPD, and it has a basic concept which is very easy. But if you study with a diagram, if you just memorize the definition, obviously no one can learn like that. So now let's draw the diagram, and let's discuss. Let's make the right eye defective in this case. So if there's a defect in the afferent fibers of the right eye, the light reflex, it will not be transmitted to the midbrain at all. So the right eye as well as the left eye, there will be no constriction. because the afferent fibers coming from the right eye, you have cut them off due to any lesion, any tumor in the brain, or any other lesion, any other disease. So that will result in no constriction of the pupil. So now let's come to the left eye. The right eye showed us that there is no constriction in both pupils, but the left eye has normal afferent fibers in this scenario. Let's take an example in this case. So if the left eye has normal afferent fibers, then the light reflex path will go to the midbrain, and it will innervate both the Edinger-Westphal nucleus, so resulting in direct light reflex of the left eye that will constrict, and the indirect also. See, the right eye efferent fibers are fine, but the problem was in the afferent fibers not transmitting the information. So that's why when you shine light to the left eye, it will result in direct light reflex of the same eye and indirect light reflex of the other eye. This tells us that there is a defect in one of the afferent fibers of the eye. And I'm going to make this or discuss again with another example, so this gets more clear, and the same scenario, but I'm discussing it with the pupils only, so just to make it easier. So in this case, no constriction because the right eye is defective, the afferent fibers are defective, the afferent, I'm talking about the afferent, not the efferent. So no constriction in both of the pupils. Now you come to the other eye, the left eye. That has normal afferent fibers. In this scenario, let's assume it will result in direct light reflex of the same eye and the indirect light reflex of the other eye. So both pupils constrict. And now when you come back to the defective eye, see, this test is called a swinging test. You have to come back to the defective eye. The pupils will again start to dilate. That means this confirms your diagnosis. You can say that there's obviously a problem in the right eye, that it's not transmitting the information, but its efferent fibers are fine. That's why the indirect light reflex from the left eye did constrict the defective eye pupil. So both eyes will again begin to dilate. So since you have come back to the defective eye again. Just an MCQ can come, or just another point is that the defective pupil is known as the Marcus gun pupil, and obviously it's on the doctor or the guy who discovered it. And the test we use for this is that the swinging light reflex. Since you swing the torch from the right eye to the left eye and again to the right eye, so this is a swinging light reflex test that is used for this. That's all for today, guys. Hope you enjoyed the video. Take care.